Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor at the University of Kansas Medical Center. This is Open Mics with Dr. Stites. We want to take a minute to do what we all should be doing this month. So stand up. Let's get our flu and COVID vaccines. Our Medical Director for Infection Prevention Control, Dr. Hawkinson, is ready to roll up his sleeves as well. Two of our finest nurses are ready with the vaccines. With us are Brittany and Diane, and we're both going to get a COVID shot and a flu shot. We are standing up for vaccination. Right there, brother. All right, Doc Hawk, let's start with the COVID shot. Who should receive the updated COVID-19 vaccine this year?
Yeah, and I understand there's been a lot of confusion. You know, again, previous years, the recommendation was anybody 6 months and above should get their updated COVID-19 vaccination. There was a little bit of turmoil in September of this year. The new CDC and ACIP recommendations were a little bit different, but luckily, October 6th, they made it much more simple for everybody to get it and understand who should get it. And they just basically said individual-based decision-making or personal choice. So that makes it very easy. Hopefully that will remove some of the barriers to people going to local clinics or commercial pharmacies to be able to get that COVID-19 vaccination. But what I will say is that we do have our medical societies that have created their own, again, evidence-based recommendations for the updated COVID-19 vaccine. So particularly ACOG, which is the OB-GYN Society, AAFP, which is the Family Practice Society, and AAP, which is the Pediatric Society, have all made their recommendations. And basically what it boils down to, in looking at the data of safety and efficacy of this vaccine, the recommendation continues to be really anybody 6 months and above should get an updated COVID-19 vaccine.
You know, Hawkeye, to me it's like the scientific folks are saying this, the truth about it, and then the political folks are out there doing something a little different.
A little bit different.
I'm kind of buying the science here. So now what about the flu shot? You can catch the flu even if you're vaccinated. Explain how the vaccine reduces those risks to you, though.
Yeah, absolutely. And this is, you know, something about messaging that we probably should have been talking about even when the first COVID-19 vaccine was available. It had the benefit of helping reduce infection, but really what all of these vaccines are for is to help reduce the disease and the complications from that disease. The same thing goes with influenza vaccine. It is not meant to stop you from getting the flu, but what it is meant to do is that when you are exposed and do have influenza infection, significantly reduce your risk of complications. And what I will say is a recent MMWR publication out of the CDC did show that in the Southern Hemisphere, and again, we typically follow the Southern Hemisphere in our Northern Hemisphere influenza season, there was about a 50% reduction in going to the hospital or going to the clinic.
There's a knock on the door. Who could this be? Holy cow.
Okay.
Who's crashing this, Coomer? Are you trying to take over this program again?
Yeah, I thought this was Open Mics with Dr. Coomer today, no?
Oh, here we go. Lord. All right, I think we got some colleagues coming in these to get their vaccines. Coomer, who did you bring with you?
Dr. Chetiar.
Dr. Tara Chetiar, one of our OBGYN doctors. So Sean Coomer, transplant surgeon and Chief Medical Officer for the Kansas City Division, and Dr. Tara Chetiar. How was that?
Look at you, you rocked it.
That's because he just repeated it again. With OBGYN, we're going to make room for you both in here to get some vaccinations. Dr. Coomer, we ask our employees to get their flu shots. Why is that so important?
Well, it's about protecting yourself, but it's also about protecting your patients and those that are vulnerable. I mean, I think that's the biggest thing. We all have folks that are, you know, in our family that are potentially sick and have chronic diseases, as well as our patients. So we need to protect them as much as we're protecting ourselves.
Okay, and Dr. Chetiar, you're getting both the flu and the COVID vaccine, like me. We're standing up for vaccination. All right, you work at a clinic where prevention is really important in the OB clinic,
part of my job, yeah.
You bet. Okay, so tell us what the guidelines are for expectant mothers.
Oh, it's super easy. They're the same as everybody else.
I like that.
I know. It's great. But like Dr. Coomer said, when we think about populations that are at risk, pregnant women are one of those populations. Pregnant women's lungs just don't work quite the same as other people. They lose some of that respiratory reserve. And so the flu can be really dangerous for them. And then we're thinking about when we vaccinate mom, we're basically vaccinating baby because we pass those antibodies on. So it's super important just for mom and for baby. And then as an employee, my patients really need me to not be the source of their infection. So.
Well, I remember during the height of the pandemic, there really was no controversy. You absolutely should get vaccinated if you're a pregnant mom, because we were seeing the bad outcomes in pregnant moms who weren't vaccinated.
Absolutely, absolutely. We had folks in the ICU and some really sick patients out there that hopefully we can prevent that.
All right, well, we're going to work on that today in just a moment. Dr. Talk, let's remind everyone the guidelines for flu vaccines. Walk us through who needs those.
Yeah, again, anyone 6 months and above, it is a recommendation to get influenza vaccine for you or your loved ones. I will say my son is away at college now, and I really encouraged him to go get his influenza vaccine, and he got vaccinated last week, so I'm happy about that.
All right, well, thanks to all our docs and our nursing staff for administering these vaccines. Let's be honest, you never want a doctor to give you a vaccination. You want our nursing team to do this work. I volunteered to give Cooper his. He turned me down. I don't know why. So we're going to get that going right now. We're going to get some vaccinations on the air. I'm going to show you that I can rock a Kansas Jayhawk shirt. Right. How about that? Do a little workout, show them my biceps.
Rock
How about
chop.
that? Woo! Not bad for an old man. Let's go. A few years ago, I may have worn a tighty-whitey. That didn't go so well. Tank top. I thought people thought, uh-oh, who's in trouble?
All right, I'll just have you confirm that's
Yes.
yourself.
That is me, Steve Stites, 125.60. I'm still there. Actually, it was supposed to be 125.90. I don't know what happened with that. Let's do a little better on that one, right? All right, took my double dose of Naproxen this morning and Tylenol. And I'm just kidding. Oh, look at that red Kansas. It doesn't look bad. I even went to Mizzou. How about it? I can do it, man.
Oh, wow.
I've been here for 25
I didn't realize you were
years.
crossing the line.
I did. Well, I've been at KU for 35
you.
years, so I figure I can wear whatever.
You can do a little better.
That's how
Yeah.
I look at it. I'm pretty loyal around here,
It didn't hurt.
Been at the University of Kansas for a very long time. Now I'm showing my deltoids off. Here we go.
And again, I think we should say that it is also okay to get the vaccines at the same time. And obviously you saw, I just got both of mine in the same arm, and that is perfectly acceptable as well.
Thank you.
And it's okay to get them
It's so
separately as
easy.
well.
It is.
Because I got my COVID vaccine already, so
Yep.
I'm getting my flu today only.
Yep. And I got one in each arm because I want to show that I'm bilateral. All right. Are we all vaccinated now?
Not quite.
All right.
getting there.
Tara, here we go.
Just have you confirm that is yourself.
Yes, that's fine.
Well,
And I just
Let's
need you
see.
to confirm this is your name.
yes, that's me.
Yes,
Perfect.
Tara Chediar,
All right, and then we're just
1893.
doing flu.
Yep.
I would also
far,
say that beginning November 1st, we should start keeping data on our admissions and testing for respiratory viruses, including influenza, COVID-19, and RSV. And overall, across the nation now, remember a couple months ago, there was an increase or a peaking of COVID-19.
Yep.
Luckily, we saw that decrease. It has been decreasing for the past
great.
few weeks.
Good.
And again, influenza activity remains very low in the United States right now. We are entering into the early part of November, so if you haven't gotten vaccinated for either, please go get it and build up that immunity.
And while I have not been pregnant for 10 years, I will say that on top of the flu and COVID vaccine, we do tell pregnant women to get an RSV vaccine between 32 and 36 weeks, and usually another Tdap every pregnancy, even if you're up to date on it, at about 28 weeks or sometime in the third trimester.
Right, and that's just because, like you said, when mom gets vaccinated for RSV, she transfers those antibodies to baby to protect baby, especially in that high-risk period.
And it's been working. I heard
Yeah.
Children's Mercy had to cut back on staffing last year because they had so many fewer RSV admissions. So pretty great.
The numbers dropped a
Yep,
lot, I think.
pretty great.
So.
It's a pretty amazing story about the RSV vaccine.
Yeah.
It really is.
And you know, the KU was part of that clinical trial, so it was pretty. It was a pretty cool experience.
And we
Yeah.
led the nation in enrollment in one of the COVID trials. So I'm just saying,
We're-
pretty good stuff
Yes.
here. How was that? Thanks to all of our docs and nurses, but let's forget the docs. We didn't do anything. To our nursing staff, to Dane,
Thank you.
to Brittany, thank you guys very much for coming down,
course.
letting us embarrass you on the program a little bit, and thank you for doing your part, and all of you to help protect our public and to send out an important message to everyone.
Thanks for having
Vaccination
us.
is safe. So let's rock it. Thank you.
so much, Dr. Stites.
Appreciate it.
Rock chalk.
Thank you.
All right, now I'm going to switch back to just, oh, wait a minute. Oh, I'll just put this on now. Here we go. Leaving the Kansas on, and we're going to jump topics now, and we're going to start looking at something many of us enjoy, a little bit of alcohol. You know, that glass of red wine, that looks pretty good at the end of the day, but alcohol may affect your risk for cancer. It used to be that glass of red wine we thought could be good for you, and maybe in some ways it still is. But could a few drinks, or even a couple of drinks every day, or even a few times a week, leave you with a much higher risk for certain types of cancers? Newly released data reveals an increase in cancer rates in at least 7 different types of cancer: liver, throat, and breast cancer, just to name a few. Queen Asia was in her late 20s when she was diagnosed with breast cancer. And as she told Jessica Lavelle, she often wondered if her woulda, shoulda lifestyle coulda cost her her health. That's pretty good. Woulda, shoulda, coulda. Let's see.
Queen Asia always lived it up. She loved life. She loved her friends and her job as a bartender. She lived life to the fullest, hanging out and laughing, staying out late, until those smiles one day became forced.
It was just putting on a smile, like I'm okay. Even though the fears you have, and you look at your children, like, are they going to have a mother?
Quina remembers the flood of emotions when she was told she had breast cancer 6 years ago. She was only 35.
I was doing the home self-checks, and it felt different. I didn't do it often, but I did them enough to know that it was different.
She brought it to her doctor's attention. Quina had just had a baby. That doctor chalked it up to fatty breast tissue, or perhaps a clogged milk duct. Quina was given antibiotics. That didn't work. 6 more months would pass. Finally, Quina was referred to the University of Kansas Cancer Center.
Turned out to be about an 8 to 9 centimeter breast cancer tumor.
Testing revealed it had progressed to stage 3 HER2 positive breast cancer.
I heard cancer. That whole conversation went, yeah. It went over my head. I remember that day, like it was Valentine's Day when they called me.
Quina underwent rounds of chemo and a double mastectomy.
Obviously, your hair falling out, you become a different person. You become a whole new person. And you're fighting.
Quina took inventory. She tested negative for any genetic markers for cancer. It got her thinking. Had her lifestyle caught up with her?
I mean, it was alcohol, but it was also the unhealthy eating. I was, as a, bar employee, you're on the go. The hours are crazy. You're eating fast food. You're eating processed food. And I drank on, after the job. I mean, it's the bar scene, right? And you're in your 20s and maybe even young 30s. I had a vicious cycle with alcohol, too, as dealing with depression. Yeah, my lifestyle was not the healthiest.
While nothing is certain, Quina felt a sense of power, taking accountability.
Especially after researching and watching those things and just kind of starting to take care of my body more as I age, because, obviously I'm a survivor and there's always a chance for reoccurrence. I want to prevent it as much as I can, to be here as long as I can.
Well, joining us virtually is Dr. Rahid Al-Rajabi, a medical oncologist with the University of Kansas Cancer Center, who will share his insight on the effects of alcohol on cancer rates. But first, Quina, thank you for sharing your story and how you are feeling. How are you feeling?
I'm feeling great.
Where does your cancer stand today?
I'm cancer-free, or I think people call it NED, no evidence of disease, so that's great news. And
that is great news.
Continuing my follow-ups and, expecting, hopefully, the same results as I continue to move forward in life. So.
All right. Well, sitting next to you is Dr. Ryan Taylor. He's a hepatologist. He's also the director of our liver transplant program here at the health system. And to my left is Dr. Steve Wyman. He's a gastroenterologist and hepatologist and director of our liver center, which is our research side of our program. He's been involved in research specifically on alcohol-associated liver disease. We have a wonderful team of experts. Quina, nobody's more of an expert than you are. You've had cancer. I think that gives you insight others may not have. Well, we often look at genetics or other factors when it comes to a cancer diagnosis. What made you look back and think, Queena, that it could have been lifestyle related?
Well, I definitely remember the process and taking the genetics test, and so that was the start to figure out why I was in this situation, why I was diagnosed with breast cancer, and came out, negative for all of the genes. And as I look back at my journey and like taking care, I watched YouTube videos. I did some research on, if it wasn't genetics or, what could it possibly be? And the more I researched, the more I read about the effects of alcohol, how it raises estrogen, and that's the type of cancer I had. I had HER2 positive cancer. So it just started to piece together, and the more I read and the statistics of, drinking more, the more you drink, it increases your chances of, getting this type
cancer.
Of cancer.
You bet.
Yes.
So you also had a friend diagnosed about the same time. Did you guys both share that kind of coulda, woulda, shoulda lifestyle habits?
Absolutely.
Yeah,
I think it was
yeah.
one that I was partying with a lot.
All right.
In my youth, yes, definitely.
How did you change all that? Because that's a lifestyle that's often ingrained. You're within a social group or your friends or your sports system. How did you change that?
Definitely my faith and going to church, and my family. The research I was doing, it started by losing, the weight I gained, and then it just became more of how to prevent the reoccurrence of, this disease that I spent that much time fighting. I mean, it wasn't an easy process. It was hard, but I wanted to take care of myself, and I also have a daughter.
Well, that makes a difference, doesn't it?
Yes.
Those things, those daughters, those children, they impact our lives and impact our decision-making process a lot, I think.
Absolutely, and I wanted to be a good role model. I wanted her to be, not to make the same mistakes I did as I learned more and more, as I assume it was. I definitely think it was the lifestyle, the alcohol.
Well, we're going to be we're going to start digging into here about how much alcohol it takes to do all this and talk about the interaction of alcohol in our environment and our bodies. But Queena, that's a great story, and the fact that you've been able to stop the lifestyle because you want to take care of yourself and enjoy the rest of your life, which could be very long as you take care of yourself and that of your daughter. That's great. All right, Dr. Al Rajabi, you're a medical oncologist, and you do a lot of GI cancer work. Research shows genetics play a role in how alcohol impacts the cancer risk. Talk to us a little bit about how much of risk is family history compared to lifestyle, compared to genetics. Talk to us, how do we figure that out?
So, of course, genetics definitely increases your risk of inherited cancers, like situations in breast cancer and colon cancer. Now, the addition of alcohol to patients that have predisposing genetic risk to cancer modestly increases their risk of developing cancer in the future. But looking across the whole population, just regular consumption, and it doesn't have to be a lot, could increase the risk across the whole population. We see about 100,000 cases or more a year associated with alcohol that have been diagnosed with cancer, and about 20,000 deaths across the U.S. Now, there are some genetics that would affect how we process alcohol in our bodies that could potentially also increase our risk. So there's a lot of factors here that overall can lead to the development of cancer when you have regular consumption of alcohol for a prolonged period of time.
So the National Institute of Alcohol Abuse and Alcoholism says a standard drink contains about 14 grams of pure alcohol. That's about 12 ounces of beer, 8 to 10 ounces of a malt liquor, 5 ounces of wine, and 1.5 ounces of 80 proof liquor or spirits. So guidelines are based on these standard drink sizes, but this may not reflect the actual serving sizes, of course, people are actually drinking. Dr. Wyman, when we talk about too much alcohol, what do we really mean, and what organ and what disease are we talking about? Because they differ between different diseases.
Right. Well, alcohol, everyone I think is very familiar that large amounts of alcohol can produce a lot of severe diseases in the body, particularly liver disease, but also other things such as pancreatitis and pancreatic disease, intestinal disease, heart disease, and so on. But cancer risk is a little bit bit different. Cancer risk doesn't go to zero even with lower drinking. So we think of certain thresholds, like for example, people who drink less than 1 drink a day, that's considered to be like close to a non-drinker. People who drink 1 drink a day for women or 2 drinks a day for men, that's about the limit of what we call, not harmful drinking. So more than 1 drink a day for women or 2 drinks a day for men is really considered a harmful pattern of drinking. And that's when people start having develop risks for liver disease. Now, cancer risk is a little bit different. So if you compare, when you understand cancer risk, you have to think that everyone, drinking or not drinking, has a cancer risk, and we're all at risk for cancer. So the lifetime risk for breast cancer, for example, in women is about like 10%. And if you drink 1 drink a day, that increases it to about 13 or 12% or so. And if you drink 2 drinks a day, it increases it more to like 15%. So you have to think of cancer risk as even more within the range of what we call moderate drinking. That's not going to give you cirrhosis of the liver, but it still can slightly increase cancer risk.
So, some people may not drink all week, and then all of a sudden they go to the Chiefs game, and every first down is another drink, and all of a sudden, they're kind of lights out there with the alcohol. So can that kind of binge drinking be more harmful than more consistent daily drinking?
Yes, a lot of studies have looked at this. And in fact, binge drinking is more associated with organ disease, such as liver disease. And binge drinking is defined as maybe 4 drinks at a time within a 2-hour period. For women, 5 drinks at a time in a 2-hour period for men. And that qualifies as binge drinking. There's such a thing called high intensity drinking, which is about 2 or 3 times that much. So like on the order of like 10 drinks in a 2-hour period. And this pattern of drinking is associated with many more health effects than just sort of steady, moderate drinking. These are the drinking patterns that lead to automobile accidents, blackouts, neurological problems, and that is a serious thing. Cancer risk is probably not that different. It's really more about how many drinks you have in a week.
All right, so now Dr. Taylor, early detection of liver damage is important. Symptoms can often show up late in the course of the disease. What screening tests would you suggest for someone who might drink more regularly?
This is a tough thing because a lot of patients with liver disease have no symptoms. There's no outward sign they have a problem. So we rely on testing to give us an idea where they're at. So we start with blood tests, so what are called liver function tests, or LFTs, you may know. And those are our basic tests that we start with. But the problem is sometimes people can still have liver disease and have normal liver tests. So additional imaging, such as an ultrasound, if you're really concerned, can be a place to go. And there's new technology now where we can actually assess how much scar tissue and fat there is in the liver without a needle biopsy. This is called a FibroScan, and this is another way to assess people.
So lots of ways. Now, once you drink alcohol, it is converted in the body to acetaldehyde, which we know can damage our DNA. So now, how does this process prevent cells from repairing themselves or repairing the damage? There's something about this particular metabolite, as we would say, that's causing us a lot of problems.
Sure. So there's a metabolite called acetaldehyde that ends up causing cross-linking of your DNA. So your DNA is your code, and as part of the copying, it has to come apart to be able to make copies so your cells can grow. But the acetaldehyde can actually cause cross-linking and not allow that zipper to come undone.
And then all of a sudden, the proteins or things you make either A, don't get made, or B, are made in an error, and then your cells can't even repair themselves right, and pretty soon they start growing out of control. And you know what we call cells that are not growing out of control? Call it cancer. Yes. All right. So the liver is what most people associate with drinking, Dr. Whiteman. Data shows that heavy drinking increases oral in your mouth and oral and throat cancers risk up to 5 times, while liver cancer risk can double. Tell us why some organs are more vulnerable than others.
Well, there are really three types of effects that lead to alcohol-related cancer. So in mouth cancer, throat cancer, esophagus, laryngeal cancer, the problem there is the direct contact of alcohol with the tissue that, as Dr. Taylor described, can cause damage to the tissue. And this cancer risk is worse if you drink high-proof alcohol, where the high alcohol exposure is there, and it seems to be worsened in people who smoke cigarettes. The risk of like oral or throat cancer is maybe 4 or 5 times higher in people who drink than in people who don't. A second kind of cancer risk is like for liver cancer. And in that case, the alcohol doesn't cause cancer just immediately by itself. What alcohol does is it causes damage to the liver. And ultimately, you can get severe scarring of the liver that's called cirrhosis of the liver. And once you get this alcohol-induced cirrhosis, that's when cancer risk really increases. There's really not that much cancer risk from just drinking alcohol on the background of a normal liver, but alcohol will damage the liver. And then the third kind of cancer risk is just that alcohol disturbs the hormone status of the body. It changes inflammation in the body. It causes certain cellular growth factors to change. And that's probably what's involved in breast cancer risk and colon cancer risk. So there's really different ways that alcohol causes cancer.
So, Dr. Al-Rajabi, even light drinking has been associated with a small but measurable increase in breast cancer risk, around 1.04 times the risk. How does moderate drinking affect breast cancer, and are there any safe drinking levels?
Well, honestly, I think just like smoking, alcohol is being considered a level 1 carcinogen across the world. There's a lot of countries in Europe that have added warning labels on their alcohol products, indicating that it'll increase the risk of these cancers. I think the safest amount of alcohol to be consumed is none, and that's what our dietary recommendations in the United States are. If non-drinkers are encouraged to stay away from alcohol, patients that do consume alcohol were recommended the levels that Dr. Weinman indicated, with 1 drink for women and 2 drinks for men. But I think in breast cancer, even small amounts of alcohol change the hormone levels, the estrogen levels in your bloodstream, and induce breast tissue growth and carcinogenesis or development of cancer. Definitely higher doses, may increase your risk even further. And if you start drinking before your first child, that also is a higher risk factor, especially in breast cancer. So it's really, the safest thing is to stay away from the effects of alcohol if possible. In GI malignancies, just like Dr. Weinman said, it's definitely dose dependent. The higher the dose, the more you see of those types of cancers, and adding smoking to that really magnifies the effect.
So it's interesting. I heard the news. I don't drink a lot anyway, but I heard the news that's been breaking over the last year around this. It made me think, should I even drink at all? So maybe 1 or 2 drinks a week, so not very much, because the information that's gathering around the cancer risk is pretty strong. I don't know. Did it affect you guys at all? Did you?
Yeah, I think so. I think, first of all, there's no such thing as no risk. We're all at risk, and I believe very strongly in this idea of harm reduction. Less is better than more, but you don't. You can't say, if I can't go to 0, what's the point of cutting down? I think that's not the best way of thinking about it. And people who drink, less than 1 drink a day, so a couple of drinks a week, have a very modest increased risk of of cancer. It's not zero, but it's, on the order of, 1% or something like that.
Yeah.
People who drink more than 2 drinks a day have a fairly large or relatively large increase in cancer risk, and I think that is an unhealthy pattern. And then it's for each individual to make their choice. Having zero risk is just not one of the options for going through life, and that's what you have to balance.
Doctor, your thoughts?
Yeah, absolutely. It's made you pause and think about things, and you walk around the tailgating at the Chiefs game, and you start to.
There's no pause.
You start to think about this, but it definitely is concerning with this data that's emerging. I think we should all take a pause and think about that.
And Dr. Al-Rajabi, if my memory serves correctly, you don't drink much alcohol to start with, and so I don't know if this would have changed your thinking.
Well, yeah, I don't drink much alcohol at all, but it has. It was an eye opener when I looked at the statistics. 53% of patients being diagnosed with cancer regularly drink, and some of them are much more excessive than the standard recommendation. So I think there's definitely a very, very strong relationship here.
Queen, now I know we're going to get to our studio here for questions in just a second, but as you hear this discussion, I mean, you've had cancer, you felt like it was related to drinking, now you don't drink. What do you think of it? As you hear this conversation?
I mean, it just proves more and more, like with the lifestyle I had, it's definitely, it's confirmed that, without the genetics, that my lifestyle definitely was a reason for my diagnosis.
Yeah, coulda, woulda, shoulda.
Absolutely.
I love that when you said that. That was really good. All right. We know many of you have questions. We're going to head to Studio B with Alexis. Good morning. Are you vaccinated, Alexis?
I'm about to get vaccinated next week.
Excellent.
I'm all set.
All right.
I just want to thank Queena, first of all, for coming on and sharing her journey, because it's not easy to do, and you're super brave, and you're going to help a lot of people by sharing your story. So thank you for that.
Thank you so much. Thank you.
Becca does have a question between men and women, and I think this was touched on a bit. Becca wants to know, how are men and women affected differently by alcohol-related cancer risks?
Dr. Al-Rajabi, you want to tackle?
I think there's a lot of difference in the genetic makeup of our body habitus and how we metabolize alcohol. I think that's the main concern is, how fast men and women can metabolize alcohol. It's a very slow process, and if we overwhelm the process, then we have those harmful byproducts that develop. So I think that's really the difference. Fat content between men and women, of course, also differs, which affects how much you can clear the alcohol. So I think that's, and of course, cancer risk between men and women is also different, just from other genetic factors. So there's a lot of factors that make it a little different between both of them and make women more susceptible.
All right. Go ahead.
Go on. Marie has a question about the pandemic. She wants to know when you think you'll be able to see if the increased drinking during the pandemic has affected cancer rates, because many people will attest to drinking more during the pandemic when we were all stuck inside.
That's a great question. Okay, who wants to tackle that one? Because I'm not the right one.
I mean, I certainly can address it from just a liver perspective. That it, very early in the pandemic, we are already starting to see problems with alcohol rise, and it's just we're still seeing just the very early parts of this. It's a tidal wave that's coming. It's something that everyone has recognized and been a big concern that we have.
Yeah, I also think there's a lot of data actually that liver disease got more severe as a consequence of drinking during the pandemic, and higher incidences of severe alcoholic liver disease, particularly in young people. I have not yet seen published data about cancer rises, and typically cancer is a long-term consequence of things, but I think Dr. Taylor is, said it well, that there may be a tidal wave on the way.
Alexis.
Yeah, we also, I think we'll see a lot more patients. We have had a flood of cancer patients, especially in breast and colon, after the pandemic. Whether it was from alcohol, I doubt it. I think it also affected our screening process significantly, and we've definitely seen a rise of these younger cancer patients at our institution.
Yeah. Tidal wave is such a strong word. Jill has a practical question. She wants to know if there's a difference in risk between brown liquor, clear liquor, beer, or wine as it relates to breast cancer. A specific question, but a lot of women want to know the answer to that.
Dr. Al-Rajabi.
No, there's really not. Studies didn't really show a difference. It all depends on the alcohol units, and they differ in how much alcohol they contain. The higher, longer exposure is what we're concerned about. But it really doesn't make a difference which type of alcohol you consume.
Nuts. Jeremy has a question. Jeremy wants to know, this is a good one, does drinking increase the risk of certain types of cancers more than other, or are you just talking it increases the risk in general for all types?
Al-Rajabi.
So far we've had we know about aerodigestive cancers. That means throat, esophagus, liver, of course, both biliary and liver cancer, breast, colon, but we're also seeing higher incidences in bladder cancer, kidney cancer, and I'm pretty sure pancreatic cancer will be joining the group over time. So I think with more research, we will discover that more cancers will be related to alcohol in the future. But right now, those are the main ones.
You didn't mention prostate cancer for those of us that are prostate cancer survivors.
Yeah, I'd like to just add a comment to that.
Please.
The most important alcohol-induced cancer is breast cancer, just because it's so common, and the most cases are breast cancer. But the relative increase in risk for breast cancer from alcohol is small. But things like throat cancer have an enormous increase in risk from alcohol.
Esophageal cancer.
Yeah, esophageal
all
cancer,
those things that have the full
laryngeal
toxic effect
cancer,
directly there.
oral cancer, and liver cancer as well. It's a relatively rare cancer, but the risk of people who have alcohol-related liver disease is so much higher. I mean, many, many-fold higher than people who don't have liver disease.
All right, well, this has been a great discussion, and I am grateful to all of our guests who are here today, especially you, because to Alexis's point, it takes courage to come on and have the whole world hear your story, and then to stand up for cancer and to stand up against coulda, woulda, shoulda when it comes to that choices. We're going to go around the table and just ask everybody about their final thoughts. Dr. Taylor, we'll start with you.
I just wanted to mention that, we're changing our perspective on how we look at alcohol. And there's, alcohol abuse is one thing, but even people who use alcohol, which we would consider in moderation or relatively small amounts, can still have problems. So we have to get away that, you don't have to drink a case of beer every day to end up having health problems from alcohol.
All right. Dr. Weinman.
Yeah, I would just like to comment that there's a lot of help available to people who have a problem with alcohol. As you know, we didn't really talk about it today, but alcohol is an addictive substance, and there are people who, in spite of their best efforts and sincere desire, are just not able to reduce their drinking. And I recommend you look for the NIAAA Alcohol Treatment Navigator. Just Google Alcohol Treatment Navigator, and it'll give you a link to a website where you can find alcohol treatment resources in your own community. And I think that's just really important to realize that this is a solvable problem. Some people need help, and help is available.
All right, Dr. Al-Rajabi.
I echo my colleagues. I think they stated it wonderfully. I would definitely say the same thing. Don't risk it. If alcohol is not necessary for a lot of functions, and If you ever feel any symptoms, seek help and advocate for yourself, especially with breast cancer and colon cancer. We are definitely seeing a significant rise in our population. And if something's wrong, just like Queenie did, please advocate for yourself and keep following up with your doctors, just making sure that you're absolutely sure that nothing's wrong.
Final thought.
I would like to say every sip of drink that you take matters.
Every drink counts.
Advocate for yourself. I agree with that. And also, I mean, we're adults. I mean, I know everybody's going to drink at some point, but just know the risk and drink in moderation is what I'd love to say.
Thank you. Thanks all of you all for being on the program, but especially you, because that's your testimony is just powerful.
Thank you.
Especially to those out there who say, oh, that could be me, right? Oh, that could be me. And thank you to all of our audience. You know, we talk a lot about faith, hope, and science, and today we really had two different discussions, right? Two conversations. One, we stood up for vaccination. Yeah, we showed our biceps, our delts. Mostly we showed our desire to let you know that vaccination is safe and still relevant and can still help you. Lots of stories out there about, you know, causing autism, etc. So much evidence to say that's not the case. Ultimately, it's a personal choice. You have to decide if you want to have a vaccination to help you protect against severe disease from both influenza and COVID. But as far as the science goes, there's no question about the reduction in your risk for bad outcomes for those diseases with vaccination, which is why I was okay with showing my deltoid, or what I have one. But it's also the same story, really, when we start talking about alcohol. It's nice to ignore it because we all enjoy, or at least I enjoy, a glass of wine or an old-fashioned. But at the end of the day, it's about how much risk do you want to have. And from our panel of experts between Dr. Al-Rajabi, Dr. Weinman, Dr. Taylor, most importantly, Queena, we've gotten the clear message that sometimes even a little can be too much. And what I would say to you is that's especially true if you already have other risk factors for cancer. Piling on risk, watch out for where that takes you. And that's why today we focused on the science, so that we give you the hope to know that the evidence is solid, the faith to believe in us, because we're going to be right here trying to tell you the truth every single time, and ultimately you make the decision. So coulda, woulda, shoulda isn't what you wished you hadn't done before. Have a great day. We'll see you next week.
I'm Alexis Del Cid on the next All Things Heart. No symptoms, no warning. So thank goodness she's as giving as she is. You will meet the nurse whose routine blood donation saved her life Thursday at 8 a.m.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.